the arrogant doctor could never see. Angela tried to focus on her work, but the atmosphere was suffocating. The patient's eyes never left her, and the more she noticed, the more unsettled she became. It was as though he wasn't just watching her actions. He was studying her character, testing her resolve. And though he hadn't spoken a single word yet, his presence felt louder than Harris's insults. The tension grew unbearable. Angela finally met the old man's gaze, searching for something, pity, comfort, or even disapproval. But what she found instead was a quiet intensity that sent a chill down her spine. He seemed to know more than he was letting on, as if the entire humiliating encounter had been meant for his eyes, as though he were silently storing it away for a reckoning that was yet to come. When the storm of insults finally died down, Dr. Harris snapped the patient's chart shut, and stormed out of the ward without so much as a glance at the man lying in the bed. The echo of his polished shoes faded down the hallway, leaving behind an almost eerie silence. Angela exhaled slowly, her shoulders trembling from the effort of holding herself together. For a moment, she thought she was alone with her thoughts. But then a soft, gravelly voice broke through the stillness. "Don't let arrogance take root in your heart," the patient whispered, his voice weak but strangely steady. Angela turned sharply, surprised that he had spoken at all. His eyes were open now, fully focused on her, carrying a weight that seemed far heavier than his frail body suggested. Men like him, they shout because they fear silence. They belittle because they fear truth. Angela froze, caught off guard by the wisdom in his words. They weren't the casual reassurances of a patient trying to comfort a nurse. No, his tone was deliberate, almost prophetic, as though each syllable was chosen with precision. She felt a strange shiver crawl up her spine, not from fear, but from the uncanny sense that this man knew something more, something she couldn't yet see. For a long moment, the only sounds were the beeping of the monitor, and the distant rumble of thunder. Angela tried to find the right words to respond, but none came. She simply stood there, staring at him, feeling as though his warning was not just about Dr. Harris, but about something far greater, something that was about to unfold. The old man, however, said nothing more. He simply closed his eyes again, as if satisfied he had planted the seed he intended. Angela gently adjusted the blanket over him, her hands trembling slightly. She had tended to thousands of patients in her career, but never had she encountered one whose silence carried such weight, or whose few words struck so deeply. As she moved away from his bedside, she couldn't shake the feeling that his calmness wasn't resignation, it was patience. He was waiting. For what? She didn't know yet. But something told her that this quiet warning was only the beginning of a storm far more dangerous than the one raging outside. The next morning, the hospital buzzed with unusual activity. Angela noticed it the moment she stepped back into the ward. Administrators rushing through hallways, hushed phone calls